MedBix Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming. Welcome to the MedBix Webcast. This is Ramana Annamaraju, the host. No, I'm not Albert Einstein. Let me turn off the music. Sorry. This is still, um, I'm not Albert Einstein, but maybe the doctor is, that is with all the credentials. We have today, I have a very special guest. Her name is Amruti Borad. She's a family practitioner in practicing in San Diego, concierge medicine. I'm going to talk about. I did talk about yesterday concierge medicine. In India, where I'm from, my father is a doctor and a teacher. He was doing a concierge medicine there. In 50 years ago. So I think it is a very traditional concept in a lot of places. Paying with the cash. Basically, that's what it is. But anyway, that is she practices there. But I'm going after that. After I talking with Amruti Borad, Dr. Amruti Borad, I'm going to present a topic on a revolution, a woman, extraordinary woman in the history of medicine. You have to listen to her. She is not a doctor, but it's almost like a doctor. She did so much contributions to the medicine, and you will be surprised at what kind of things she went through. It's a mental, physical, all the things she went through. It's an extraordinary story I'm going to present to you. But let me, Dr. Amruti Borad, she's joining with us from San Diego. She is practicing in the University of San Diego, California university system. She's practicing. Let me bring her to the table. Welcome, Amruti. Amruti, welcome to the MedBix Webcast.
Hi, thank you so much for having me.
So tell me a little bit about your background, personal and professional background. How did you end up in San Diego?
Yeah. So I was born and raised in Southern California. I have both my parents not in medicine, but my siblings and I are. And I went to medical school and college. I did a combined program. So I went to Pitzer College in Claremont, California. And then I went to Western University of Health Sciences, which is the osteopathic medical school right next door. And I decided I really loved family medicine. I love building relationships and having the variety of just not problems, but also patient ages, and really appreciate preventative medicine. So I chose to be a family doctor, and I went to UCLA for my training, and I loved teaching. So I stayed for several years, and I moved to San Diego because I got married, and I started working at UC San Diego in a new department that was mostly focused on patient care. And then I transitioned to UCSD's concierge practice very recently after I went through my own burnout. And I've just felt like it was a much better fit. It's a much more fulfilling way of medicine. And that's how I got to, in a nutshell, how I got to San Diego and UC San Diego.
Very good. A family practitioners kind of a or like a polymath of physicians. They know everything, jack of all trades. They know everything they can do. I think it's a very useful because you could learn any field. You can practice regular family practice, emergency medicine. Then you can go back and do the OB and GYN, and then you can do anything up there, pediatrics. That is a big plus for the family practitioners. There is a huge demand for that kind of things. So a lot of people I have a lot of people asking for the family practitioners in the jobs wise, more than internal medicine, more than anything else. So some family practitioners say that I'm supposed to go to be a specialist. I want to be a specialist, they say. But in fact, there is a more demand for family practitioners. Are you happy being a family practitioner now? So you took that profession, instead of going to the specialty?
Yeah, it's a great question. Actually, when I started medical school, I really wanted to be a neurologist. And I held on to that for a while. And then when I did my first rotation in neurology, it was stroke neurology in the hospital. So maybe not the best the best setting to make the decision, but it just it felt neurology felt very research based. I felt like I wasn't making the difference that I wanted to in these patients. So I decided not to do that. And then when I started going on all my rotations, I realized that I really liked a little bit of everything. And I really appreciated the ability to develop a relationship with not just a patient, but their entire family. And I loved seeing children as well, teenagers, all the ages. So that's essentially why I picked that. And once in a while, I feel overwhelmed by having to be this, like you said, jack of all trades. I call it the Jackie of all trades. As a woman,
Jack.
but I feel overwhelmed by it and think like, oh, I should have been a specialist. But in general, I always come back to this idea that, I'm very happy being a generalist. I'm very happy being able to work with these families and being able to help them, not just medically, but socially. A lot of social conditions and problems out there that we can help solve, or at least support. And I'm very proud to be a family doctor.
Family practice is as close as you can get to the holistic medicine, because they can understand all the aspects of the human body, mental, physical, psychological, emotional, all aspects of the human complexities. So, one of the things is right now what's going on after the pandemic. We are going
Mhm.
through a humongous mental health crisis in the United States and everywhere in the world. In fact, that's a common complaint. Do you think, what do you think? Well, let us talk about the general population first, and then we talk about the physicians and the healthcare professionals, what they go through, these mental health
Mhm.
problems. Let us talk about the what's going on with the mental health in overall, in general, overall in the general population.
Yeah, in the general population, a lot of, excuse me, a lot of anxiety and depression. And as a family physician, you see a lot of that. Patients come to you first when they don't know what's wrong. And a lot of the times it's not just these it's not just a thought process, it's not just emotional, it's also very physical, and trying to figure out and tease out what the problems are. So with our population, all these things were going on in the background always, but COVID really made it more prevalent just because of what happened with COVID. You're a lot of isolation, a lot of job loss. People being separated from their families, people losing family members. I really think the isolation was the biggest piece here that propelled people to have all these mental health disorders and conditions. And I feel like I've essentially become a psychiatrist because every single person you see has some component of anxiety or depression, whether they want to tell you that or not, or believe that or not. And it's really just trying to be there for these patients and kind of explain that yes, you have true health conditions, and your mental health is making it worse. So let's figure out how we can help you. And with that being said, I really try to motivate patients to go to therapy, some form of therapy, because you're talking to somebody that's a neutral party. It's not like your spouse or your friends, but you're talking to someone who's a professional, who's trained, who has no judgment against you, and just there to listen to you and really talk things through. And then the other piece is that if you need medication, it's completely okay. It's not something to be ashamed of.
Yes.
So those two things I work on with patients quite a
I
lot.
was just I
Yeah.
was just about to ask that question. You answered
Yeah.
already. What are the stigma and the cultural,
Hmm.
kind of a cultural things? People don't talk about mental health. Even come to the doctor, and it's responsible. I think it's sometimes it's a additional responsibility of you to extract that kind of problems that what they're facing through because of the cultural background or whatever the family background, whatever it is. It is like a
Hmm.
stigma attached to it, so it is an additional responsibility of particularly in the frontline healthcare professional you are as a family practitioner, that is a bigger. What do you think of that aspect of it?
Yeah, absolutely. Culture has a lot to do with it. I mean, I'm from India and or my parents are from India, and talking about therapy or medication or anything, any psychiatric disorder is just not something that we ever did growing up. And not something that we even do now, frankly. But it's going past those cultural norms. So I do that a lot with young adults, where they might come and see me and say, like, my parents. It doesn't matter what culture, really. It's just that my parents don't, believe in seeing a therapist or whatever that may be, and then it's really helping them realize that, okay, this is all confidential, and I think your parents would rather have you well and healthy than continue down this path. It's almost like a self-destructive path. And encouraging them to discuss it with their family and their loved ones, but they don't have to, right? This is your life, your body, your personal choice. And really seeking the help you need, and just remembering that these things are confidential, and that we're here to help you and support you. And sometimes I have patients that just come see me just to do talk therapy, which I think is fine and helpful. That's the other piece of this, is that there is a shortage of therapists and psychiatrists. So we're kind of, as a primary care doctor, you're taking on more of that responsibility. And for me, I feel like, because it has such a huge and profound impact on your physical health, it's again looking at the whole person. That's what I went into family medicine for, and I appreciate having those discussions with patients and letting them know that you're coming to your doctor for a reason. There's nothing to be embarrassed about. There's nothing to be ashamed of.
Is it this social media is adding up a little bit more on this direction and creating a
Mhm.
loneliness and comparisons and peer pressures? Is that one address that how the doctors can understand that aspect of the social media influence on the children and even older people? That is, so how do you deal with as a family practitioner in your practice about that?
Yeah, great, great question, great comment. Yeah, social media. I mean, it can be used to your advantage, right? There's so many great things about social media. It connects people. It makes problems. It basically educates people on these problems that used to be hidden and people were ashamed of, and now people are out there sharing their stories and how they struggled with their mental health diagnoses and how they can help. But then there's the opposite effect, where there's people, especially when we're talking about teenagers, and college students, where you're just putting up only your happiest moments. It's just like a snapshot in time. It's not reality. But other people are looking at that thinking like that's reality. And even though we know in our mind that that's not the case, you still go there. Your mind still goes there. And then you're comparing your life to other people. And that, again, creates the sense of like, I feel less than, why is my life not like that? It creates more isolation. And on the flip side, it's a safety issue for kids, and teenagers, in terms of like people reaching out to you that you might not know. And so there's a lot of figuring out with your family, what you think is the best strategy for social media. What parent controls are you going to put on social media? How often are you going to let your child be on social media? Are you going to yourself put pictures of your kids on social media, right? That's a whole other discussion, is how do you share your kids' stories and your happy moments with your kids, or things that are going on with them publicly, and how will that impact them, especially if they're teenagers seeing themselves, within your social media feeds. So every family, I kind of tell families that, every family does this differently. And there's no like one right answer, but there are ways to kind of control your exposure. And as long as you're having this, I always try to promote open discussions within families, because that way everybody's on the same page. Everyone knows what's going on, and if your kid will trust you, and they'll feel okay coming to you if they ask, if they like talk to someone they didn't know, or they're kind of like, who is this person trying to reach out to me, or they're feeling down because their friends having a birthday party and put it on Facebook and they're not invited. Like there's just like little things that if you just have open discussions within the family, then you create a trusting environment and then you're willing to talk about how you're feeling.
Amriti, I'm in the center of Silicon Valley in Santa Clara,
Mhm.
in the San Jose area.
Yeah.
Yeah, I'm in the center of Silicon Valley. That I think, besides individual responsibility, there is a lot of systemic responsibilities. These companies, IT companies, these
Mhm.
giants of these social media companies have needs to bear some kind of a responsibility. I think medical professionals, you think you should push that in that direction a little bit more in the systemic side.
Yes. So that's also, you know, yes, physicians partnering with, like, if we're talking about medical professionals, because we see the general population, right? Especially primary care. So how do you physicians becoming very familiar with how technology works, right? A lot of us with AI on the rise, that's the next big thing, that's the next new thing. It's great for many things. It has its problems. But if you're not educating yourself as a medical professional about the things that your patients are coming to you with, or educating yourself about these companies that are building these platforms for communication, regardless of what it might be for, then you're kind of at a disadvantage. And that way, having that knowledge, partnering with these companies, you really can do a lot of great work with technology.
Very good.
Mhm.
I think, let us talk about the other aspect of the doctors themselves or healthcare professionals
Mhm.
themselves going through a mental. I interviewed several doctors, Paul Deshant and KD Sophie Cole, and a lot of people are talking about these mental health pressures by doctors I never thought doctors are out of this world. They're like a gods and they don't have these pressures. But now we see after the pandemic, you come across a lot of doctors going through, and then what I get surprised is that the suicide among the doctors is much higher than a general population. That's what the Dr. Paul Deshant was telling, was said on my show. So
Yeah.
I think it's a one thing. How do you the doctors to come out, get out of the air stigma process, and then seek help themselves?
Yeah, that's really hard. I think the hardest part when I talk about burnout, there's a few different aspects to it. Like one is recognizing that you're actually burnt out. A lot of people don't know what burnout means. Um, it's not just stress. It's
Right.
this point where, you start to feel emotionally exhausted. You're doing everything you can and seeing no results. You develop this sense of like, lack of accomplishment, low self-esteem, feeling like I don't belong, I don't think that I'm good enough for this. And then the last stage is usually what we call depersonalization, and that's becoming very cynical and negative, and in some cases, unprofessional. So it's a much higher extreme than just regular stress. And so one part of it is recognizing what does it mean to feel burnt out, whether it's all three of those things or just starting to feel one of those things. The step after that is asking for help.
Right.
And most people will talk to their friends, their family. Sometimes they'll talk to their colleagues, and then they'll go to their university or their organization because of this fear that one, I'm going to have to report it on my medical licensing. Every time I have to renew my license, I'm going to have to say that I went to therapy or I was on medication or whatever it may be, or I have this diagnosis. So there's a stigma behind that. And then thinking like, well, how can I take care of my patients, like if they know I have this diagnosis, or I'm supposed to be perfect, right? I can't have anxiety or depression. And then it's just an embarrassment sometimes, like especially if you're higher up there, you're a leader and you're admitting to being burnt out. I think making the resources available makes it easier. So a lot of universities, including mine, have made it a lot easier to just call a number that's completely anonymous
you know
and talk. Yeah, I'm sorry.
Yes, sorry about that. Well, I saw one of your position was well-being provider for the
Yeah.
other providers. So I think this idea of well-being officer of a corporations, it's we can
Mhm.
assign somebody. What this idea is an excellent idea. I just came across this idea about that putting somebody, assign someone with a well-being officer, whether there's some medical background or not medical. If they can afford, a small company can afford, if the bigger company, they can afford to hire a doctor or a nurse practitioner, or even smaller companies, they can assign one person as a well-being officer. They can listen to the, that is a very, what do you think of that idea of the corporations adopting this well-being aspect of uh, assigning somebody well-being officer?
Yeah, I think it's great. I mean, in my department, um, when I was at my previous clinic, that's kind of how it started, is that we didn't have like an official wellness director, wellness anything. It was more like me and one of my nurses or medical assistants enjoyed doing that work. So we would do it. And then it became more formal, being a wellness director and looking at all aspects of physician health. And, especially how do you deal with the EMR, right? That's a huge part of burnout, but also other well being activities and making small changes for them. Like, how do you support your physicians, meaning like staff wise, APPs, all of that coming together. So when formalizing it really helps because you're able to create you're actually able to create a plan moving forward and see what's working, what's not working, and make changes. And UCSD recently, what they ended up doing is having a wellness director for all the different departments. And then they all kind of meet together. I think it's once every few months and review what each department, feedback from each department, what's going on, what can we do differently. And they have the anonymous hotline. They now have something called the Ginger app, which is just a way for 24 hours a day to get essentially therapy, confidential therapy, or if you're having suicidal thoughts, connecting you with the right people. And now they've developed a peer support group where you're supporting each, you basically have physicians who want to support their peers. And so they're matched up almost like a mentorship, matched up with their peers to help them out. So I think the idea of having wellness directors is very important. I know that the Surgeon General, I think it was maybe 1 or 2 years ago, mentioned that every company should have a chief wellness officer. And how would you incorporate them into the organization? So that's another piece of it. I think in general, though, there's still, I've noticed this in some cases, there's still this resistance of, wellness is just like, not a priority. Okay. And I'm not saying that in my organization because it has become a priority at mine, but I see organizations all around where it's like wellness is just diet, exercise, meditation, which is necessary, but it's not sufficient. So getting people on board, like really getting your leadership on board that, you know, in my mind, I think like how many physicians have to die by suicide before you think this is a real problem. So it's getting everybody involved. Leadership has to be supportive.
It is an organizational problem. I think it is a great idea. Well-being officer doesn't need to be, even a small company assign somebody who's compassionate, some little bit of training, and say that you're well-being officer of this small company, and the people can go there and talk about it, what their problems are, and she could be confidential, or who could be, he or she could be confidential about it. And I think that listening to the problems of their own organization and their compliance is a big help. I think organizations are realizing that much nowadays. But you took a very different hat now, your entrepreneurial hat. So you started an organization, a company that is helping the medical students. I have not seen that much because the people think there is not much money in the medical students community. So we don't need to do that. You don't care about it. But after I going through my own son, I can tell you there is a big need for that. And I think a guidance and guidance, and then helping them, and then going through the complexities of this medical medical school and the residency. All of them are a lot of pressures. That's I never seen medicine is a very compared to any other. My daughter is in technology, and my son is in kind of a medical, is in clinical, in neuroscience. He was. My daughter used to tell me, Dad, my field is just simple. My brother field is extremely complex. That is about the hardest one. Now I believe, because they compare each other every day, it is one of those things that you're trying to do that, and you're trying. When I come back, I'm going to present a topic about that a little bit, and then after I come back, we can talk about your company and how you're doing, what you do with the medical students, how you want to
Sure.
help them, and we can talk about. Let me present this topic about this. An extraordinary woman. You and me are going to watch together. You
Okay.
can jump in anytime. You know that. Let me. Yeah, you can jump anytime to comment about it. You're free to
Okay.
jump in. This is one of the extraordinary women of the history of medicine. Incredible story of shaming and winning. She is a fierce feminist and mother, innovator, and prolific fundraiser, Nobel Prize winner. Actually, now we can talk about Amruti, about motherhood. I didn't talk about. I mentioned it, so we talk about it when we come back. That
Okay.
is so. This is okay. So, death of a spy. There's a in November 21st, 2006. There is a Russian spy. His name is Alexander Litvinenko. Went to London and Millennium Hotel, and he had a cup of tea. Then within 2 weeks, he is almost looks like this. Completely healthy looking Alexander Litvinenko looked in 2 weeks. This one very puzzling to a lot of people. Then he was a very critical of Putin. He was critical. He was writing a lot of articles about he's criticizing the Russian government and Vladimir Putin. He was criticizing. So all of a sudden he was defected to London, England, and then he met somebody, acquaintances, and then he had a tea in the Millennium Hotel, and then he looked like this in 2 weeks at the age of 43, healthy looking guy. So
Wow.
what was that was polonium. They found out because he is in a university of, big university school there in London. There is a lot of medical center it is. So they found out it is a classic symptoms of radiation poisoning. That is a polonium poisoning. How they found out polonium poisoning is because you cannot observe, you can see the symptoms. The only way to measure this is they have to drop, alpha radiation. Polonium poisoning is you have to ingest. So they know that he had a tea from that hotel. So he has to be ingested that one. So what they found out is that they dropped a silver plate because alpha, the polonium emits is a radioactive material. It emits the alpha particles. Alpha particles, the problem with alpha particles is they don't travel too far. They travel very short distance and interact with the matter around it, surroundings, so it will die. So they didn't know that, so they had to check it. To check that, they have to drop the silver plate in the stomach to measure the Geiger counter and measure the alpha radiation. That's the concluded polonium poison. He was poisoned with the polonium. But that is polonium is not a you cannot manufacture in your lab. It is a huge process in the extraction of the polonium. So it must be either China or a big industrial complexes has to do that. Either it's Russia or China, or some other company. Some United States have the power, have the capabilities of doing the polonium in a small quantities in a concentrated way. So they know that he was criticizing Putin. We're not surprised now with all the things happening right now. There's a new guy was so so he was that actually they made it. They traced it back all the polonium to the train station from the airlines all the way. They followed the path of the polonium travel. Actually, it's very interesting. So he died within 2 weeks. He died. So the next one is in 1917 and 1926, there was a radium girls in West Orange, New Jersey. They were doing a lot of these. Is a factory there. Is a factory is a West Orange, New Jersey. In the factory, what they do is these girls they're painting the radium clocks. That radium clocks. That eventually what they happened was after a couple of years or a few years after that they got the necrosis, like a jaw of necrosis is a death of cells. Maybe she can explain to us. Amriti can explain, but they really, the beautiful woman turned into, they shaped bad shape, and then do all those things. It's completely deformed in that process. It's very, very, very surprising, and it was not surprising to the scientists. Is the company knows in advance that this is a problem, that is the radium poisoning. That's what they call radium girls. They're putting what they do, lip, dip, and paint. That's what they told them. You lip it because you can make it
Oh,
my finer tooth. There's a lip, dip, and paint the numbers on the radium clock. Actually, when I was in India, we had a radium clock,
oh,
so it glows in the nighttime. So that was a lot of people die. They have a cancer, they have a necrosis of jaw, and it was completely deformed situations. And then eventually they could not find a lawyer to sue the government, sue the corporation.
mhm.
They all these girls eventually found a lawyer eventually, and they sued the corporation. They got $10,000 for the entire life, for their deformed shapes and everything. $10,000 for each girl they awarded. See that they got away with the murder in that sense. So
Yeah.
then they eventually United States passed occupational medicine washout was started because of that radium girls. That is the effect of the
Wow.
radium. They died. Several people of them died with a cancer, particularly in necrosis. So the second thing is the person who found these deadly materials out of one of the soft-spoken women of the medical of the century of the 19th century. She is a Maria Salomia Sklodowska Curie, long name, Curie, her maiden name, but she was born in Poland in 1867. Okay, she
Mhm.
came to then she was a brilliant already, and then she was the inventor of these two deadly materials. She's a soft spoken. The reason she was trying to invent is to cure cancer, not for the killing people, you know. So the
Yeah.
polonium, they know that radium is particularly reducing these tumors. They have some idea. It is not a completely well documented thing. It is a cancer. It is a some extent, they come to know, they kind of research is being done on that. It is shrinking the tumors. They know it is not officially, there's no peer reviewed studies there, but that was one of the things. And we don't even know radium, where the radiums are, all those things. So she moved to University of Paris, and they gave her a potato shed in the outside of the is almost the Sorbonne in University of Paris. The corner somewhere is not on the main campus. They gave her a potato shed and do whatever you want to do there. And they gave her potato shed to do the experiment. A small shed. It is a small space. She's a brilliant woman. You cannot stop a brilliant woman. What she did was, she was trying to do radium extraction there in that shed. She was doing a lot of mathematics and physics, and the sh- and the and the and the radium she's extracting from it. She's bringing from the mines. You have to bring a lot of ore to bring a small amount of 1 gram of radium is extremely difficult. You need a large quantity of tons of ore you needed to extract the radium. So that's what she's doing up there in that shed. So she was then while she was doing this, and she invented already radium, and then she got the World War I broke out between Germany and France.
Mhm.
Germany invaded France. Is trying to invade France, and then a lot of people are being killed in the border, in the Germany and the France border, and then a lot of French soldiers are dying. So she was in Paris at the time, so she wanted to help these. She is a scientist. She's a compassionate human being, and she wanted to help as a scientist. And she knows at that time. uh, okay, so the other time the first X-ray was already came in the existence. First X-ray was
Mm.
done. William Röntgen from Germany invented X-ray. That was his wife's first X-ray is the first X-ray actual of the left side. She was wearing a ring,
Yeah.
pretty sure she was. So she was married still. He's happy about it probably. So second one is that the first bullet is on the right side. You see the first bullet of the X-ray, first
Yeah.
X-ray of the bullet. So these are all. What she did was, she was not inventor of the X-rays, but she designed a first mobile X-ray unit. I used to have a
Wow.
X-ray unit, mobile X-ray unit in Atlanta. I used to do that, mobile ultrasound and X-rays. Mobile X-ray ultrasound. She did the design, the first one. She called it Petite Curie. She was a very small lady, and that's why she called it Petite Curie. And then she designed the first X-ray. That is a Jeep. But you know what? It is but she wanted to build a lot of them, take them to the front lines of the war of the World War I, and save the soldiers. And she went to military generals and the French military generals. They were not even paying attention. She's a woman. She dismissed her. They dismissed her very easily, and then no funding for her. It's just their job is not saving lives. They want to win the war. There's immense
Yeah.
competition here. So this is a that was the so she you can't stop her. She is a fierce. So she went to Marie Curie. She went to the Parisian woman of the France. They're all passion. Fashion is the biggest thing up there. She went to Coco Chanel, the heiress. Coco, she was the heiress, and she gave her a lot of money to her to build the mobile X-ray units. So woman came to she went to Parisian Woman Society, and she got all the money that she needed for the build 20 X-ray units, 20 X-ray mobile X-ray stuff.
Oh.
Coco Chanel she is the biggest contributor. Coco Chanel, she's the heiress of the Chanel company. She was
Mhm.
the biggest contributor there on the right side. You see, so she got money from the woman, and then she hired a 20 woman, and then she was a great mother. She hired her own daughter to be around this. She knows some extent at the time is kind of a dangerous little bit, but she hired her daughter Irene Curie to train there on the X-ray machines. So 20 women were hired by 20 women. They went to the front lines, and they're trying to save French soldiers' lives and do surgeries. There is a they can find out where the bullets are and do the surgeries. That's what she was doing. She's a great mother, and she trained, and she's a feminist, fierce feminist in that sense. She won the Nobel Prize twice. The discovery of the radium, she found out the discovery, radium exists in the existence of radium itself, the radioactive material, and the isolation, extraction of the radio, the chemistry and physics. She's the only woman who got they both two twice won the Nobel Prize twice. And
Wow.
there are other women won, but here she is the woman one on physics and chemistry. She's the only one. So extraordinary achievement. She has a Nobel Prize twice.
Yeah, that's
But
amazing.
amazing. So then shaming came in when she was getting a second Nobel Prize. Press came after her because her husband died, and she was having an affair with the one of the assistants in the assistant uh, with the um, the Curie in the lab. So
Mm.
so they said that she should not attend the ceremony because she was shaming public, and it was a press went after her. Einstein came to her defense. He wrote this one. It's a very beautiful sentence he wrote. If the rub, if the rabble continues to occupy itself with you, then simply don't read that. I cannot read a hogwash, small letters, hogwash, but rather leave it to the reptile for what it has been fabricated. So all this junk material is a fabrication of the is a used to leave it for reptiles. The stupid
Mm.
people, and then they can consume this for as a food. So Einstein came to her defense very strong. He was an admirer of Mary Curie. So as a Nobel Prize in her family, she won the five Nobel Prizes. She won the in her not the she won the in the family. There are five Nobel Prizes in her family. It's a family affair. She won the Nobel Prize in physics for the one, and then her husband along with her, and Pierre Curie is a French uh, Pierre Curie, and then he won the Nobel Prize along with her. There's two, and Mary Curie won second time for the chemistry, and fourth one is her daughter won, Irene Curie, for artificial radioactivity. I will explain to you in a second. And her husband, along with the Frederick Curie, they're all won the Nobel Prize. There is no other family as a family
Wow.
name with that many Nobel Prizes.
I know. I didn't know that. It's amazing. Good
Yeah, there
genetics.
is a
Good genes.
they got a good genes. So So her daughter Irene Curie, who won the Nobel Prize, actually did a contribution to medicine is quite a bit. So she was the inventor of the technique, artificial radioactive materials. She did. You can induce the radioactivity in the regular stable materials, and then technetium 99. They use the nuclear medicine. Iodine is 131. Is also isotope. They use it for in the medicine quite a bit to treat some of the diseases. So the Irene Curie is the one inventor of these two. She won the Nobel Prize along with her husband. And then the X-ray, she was taking the X-ray machine and teaching all the doctors in the Europe, traveling with X-ray machine and teaching the doctors in Europe in 1930s and 40s. Can you believe that? This is a contribution to their family serving humanity is unbelievable.
Yeah.
So Mary is a prolific fundraiser. She is Mary Curie. Her mother is a she is a she is a great scientist, one of the eminent scientists of the century. But she is also a prolific fundraiser. She's a feminist and fundraiser. She came to United States in 1930s, and then she went to Louis Carnegie family, Andrew Carnegie, the family who owns Waldorf Astoria. They gave her a woman's fundraiser for her. All women attended that fundraising party, and she raised quite a bit of money. And President, that's $150,000, like $2 million now. And then President Harding invited her to the White House, and she got a White House reception. She is a well-respected, well-deserved respect. She won the Nobel Prize twice already. By the time she was well-known, she was a prolific fundraiser. She traveled across the United States. Then 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 she got the nine. So then, because of her students, some of the students came to
Mm.
Memorial Sloan Kettering Hospital in New York. That was called a radium hospital. There was no. They used to be called radium hospitals. They're popped up all over the world because they're
Mm.
treating the cancer through radium. They put the radium on the top
Oh,
of the
okay.
tumor and to shrink it. So this is called a radium. The name of the hospitals are radium hospitals. Can you believe that? We don't know. A
No,
lot of
yeah,
people
I
don't know.
never knew that.
We never knew that. So it's a so one of the biggest achievements of the Memorial Sloan Kettering Hospital is that they are the largest amount of radium they have, 9 grams of radium. So that's the biggest. That's why they are famous even now. Memorial Sloan Kettering Hospital is famous for cancer, in fact. So this is the radium hospitals were born because the inspiration uh, uh, from the Mary Curie. The
Oh,
the She is a mother of a nuclear medicine basically. Now because of the nuclear
okay.
medicine, I used to do SPECT camera. I used to sell PECT and SPECT cameras. There are nuclear medicine cameras. 10,000 hospitals around the world, they do the nuclear medicine, and 40 million procedures per year done. Attributed to the tribute to Mary Curie. She did
Wow.
it. This is the mother of all. Nuclear medicine is she's the mother of all the nuclear medicine. So she's saving millions of lives even now, while from the grave.
Yeah.
So nuclear medicine, because of her, took off big way, and she's a lone woman in a man's world. She was in the left side. If you see that, all are men in the survey. All the physicists get together. She's the only one
Yeah.
woman up there. She was went through a depression. It's very very creative, smart people go through depression. That's a very common thing. We don't. It is really not understood. She went through a lot of bouts of depression. In fact, she felt lonely. There is a book on lone woman in a man's
Mhm.
world, and her husband died. After that, she went through much more depression, and then but you can. She is one of the eminent scientists. She was when she 1934. She died with the radiation poisoning. In fact, anemia. She was
Mm.
overexposure to the radiation, and then she died in 1934 at the age of 62.
Wow.
So she was buried in the Golden Casket in the Pantheon, the immortal Pantheon in Paris. That's where the celebrities and the political leaders and the famous artists are buried. She was buried along with them in the Pantheon. One of the extraordinary women of the century, and contributed to so much. So she was when she visited United States, she went to Yale, MIT. She visited all the colleges. She went to Smith College in Chicago, all the women get together when she was visiting. They made a chorus for her, and they sang the songs for her, praising her in Smith College.
That's
And the
great.
President of the United States said that great attainments in the realms of science and intellect. President Harding was gave a compliment to her, one of the extraordinary women of science. She is the Mary Curie, and really medicine. She's not a doctor, but she did so much to the contribution to the medicine. Thank you for watching. I have a I created a, you know, I will play at the end, but I created a website. I created a T-shirts of all the scientists, different scientists. Mary Curie is one of the scientists that I created. My first T-shirt was approved by Amazon. Is this one? This T-shirt.
That's amazing.
Yeah, I did a T-shirt with a
I love it.
stethoscope. I put an X-ray and X-ray machine and X-ray, and then Mary Curie, and I put her physics and Nobel Prize in rubidium and palladium. So I put the symbols of those things. So thank you for watching. Let me bring Amruti back. So how do you like it?
That was amazing. I haven't I didn't know all that history. So I love how you presented that. And of course, it's a very empowering story. You know, this woman, like you said, the lone woman in the man's world, going through all the motions, going through all of, you know, and we only touch the surface of what she probably went through to get there, but also to show, you know, she got over a lot of her own hurdles, probably had a lot of things on her mind and her mindset, but was still able to get past that and also help her family be successful. And like the ripple effect of just the little things that she was doing that just built and built and built upon itself. And now, like you said, saving thousands, you know, hundreds of thousands of lives.
Millions of lives probably. So
Yeah.
I wanted to ask you, so she went through depression, and a lot of people go through rough times, and during the medical college, and
Yeah.
during the people go through a little bit lesser level of pressures, like no, you know and then some people it is more higher pressure, a lot of pressure, a lot of people drop out from the schools,
Mhm.
and then medical students go through because that is the world that nobody touches them. Yeah, just you go through and don't pay
Yeah.
attention to them. And I, because I know about it, because a lot of medical students between the residency, they come to me for residency. They go through a lot of Amriti, they go through so much pressure,
Mhm.
unbelievable. And their depression is, I can see through, you know and it's, I feel that there must be some kind of organizational help that is required. I'm glad you are starting, you have one of them. Tell me about your company, that what do you do with the students, a little bit about the medical students.
Yeah. So my company is called Vorsis Physician Coaching. And, you know, I coach medical students and trained physicians, but really recently my focus has been medical students. And it's really about, it really stemmed from having a lot of pre-medical students reach out to me or having conversations with medical students about their experiences and they feel a lack of support, a lack of mentorship, and what they're going through. And even for me, you know, I was very young when I went to medical school. So it was very hard adjustment for me because most of the people that were there had this was their second career and they had families and all of that. And so just really adjusting to, you know, this feeling of, you know, I'm not good enough, right? Or I don't think I can do this. And a lot of students, you know, like you said, they don't recognize that they're going through burnout or depression, anxiety, because they're just told it's normal. It's normal to feel this way as a medical student. And medical students, you know, the biggest things that they face are this time scarcity, all this volume they suddenly have to consume, debt management. They don't really know a lot about their finances and relationships. All of their relationships change with their family, with their friends. Now they're developing all these new relationships with colleagues and attendings and residents. So a lot of things that are new that are going to come down and impact them, and they're constantly being evaluated. And they might be mentoring, or they might be their attendings might be burnt out themselves, so that all that is like trickling down. And a lot of them come with pre-existing mental health disorders or substance abuse, have had suicidal ideations in the past, or burnout causes that to happen. So it either makes it worse or causes it to happen. So for students, it's really like we had been talked about before, is recognizing what does burnout mean, and then asking for help. And most schools do have therapy. Most schools do have mentors and mentorship programs. And coaching is just a growing thing, a growing entity. It's been around forever, but in healthcare, it's something that's newer. And I was reaching out to other coaches, and you're right, a lot of them don't coach students. Most of them are coaching residents or trained physicians. So I knew that there was a need for that. And then really looking into how schools are incorporating coaching. And coaching and mentoring, they're very closely related. Mentoring is really, I'm a family doctor and I'm going to help a medical student and advise them, and it's very development driven. Coaching is very much collaborating with someone else and getting very clear on what your goals are. And it's me asking you a lot of questions to figure out what you want. I'm not going to tell you what you need to do. And coaching has been shown in students specifically to really empower them, to help them understand that your personal identity is separate from your professional identity, so that you don't confuse the two. Because when you
Beautiful.
confuse the two, if you do bad at work, then you feel bad about yourself. And these are very different things. And then also teaching them to be very adaptive, having the growth mindset, being able to learn on your own, which is so important in medicine. You have to keep up with so much information. Otherwise, you're just doing a disservice to your patients. And then balancing between patient care and caring for yourself. So with students, at least for me, like going through medical school, there were so many times when I thought I'd quit, and it was always a mentor that helped me. And I think I really burnt out in residency the first time, and then twice as an attending, which I never thought would happen. And it was a coach that really helped me see I wanted to stay in medicine and how can I make it work for me. So I really want to be preventative, and the way you can be preventative is by starting with the students.
You just to put your name on there, Amruti Borad, Devo. There's a taboo there. Going to Devo school, doctor of osteopathic school, people
Mhm.
think I'm less than other students, my friends, colleagues. I'm less than. It's one of these problems they have. It is in fact that it's one of them not spoken well outside, but it's really is that taboo is another problem that I see through with the
Yeah.
people clients of mine.
Yeah, absolutely. So I have students who have, come to me, and I just had a close friend of mine who didn't even know that, a DO school was something you could do. They thought it was going international. So like educating students on what it means to be an osteopath. And then on top of that, yes, like public education. I mean, even in my practice, um, probably in the last few months, I've been asked, what's a DO? I don't want to work with you because you're a DO. You don't know how to practice medicine, all kinds
Is
of things,
is
right?
unbelievable.
So it does come with a stigma, which it makes me laugh because it's, we actually have, I mean, it's the same training. And in fact, as an osteopath, you have more training in anatomy and physiology. And I myself still practice osteopathic manipulation in my practice. So the stigma is definitely there. And then that's another reason why coaching, mentorship, therapy, whatever you need is important as a student, to not feel like you're less than because you went to a DO school. You know, that's not the right way to think about it.
Amriti, my son is actually not because my son. I was saying that
Mhm.
he's a genius. He's smartest kid,
Yeah.
but he didn't get admission he was on the border side that he thought he took on himself. It's actually the selection criteria in the United States medical schools
Mhm.
is nothing to do with your talent, your smartness. Is basically they go through a blind procedure. Sometimes I saw a lot of recommendations, a lot of corruption also in that area. It is just a big myth that they propagate, that they tell you everywhere you're to be smartest that to get into the medical school. Is
Mhm.
that is a myth? Did you agree with that little bit about that?
So, I've looked into this a lot because standardized tests, like I'm not good. I was never good at standardized testing.
Yeah.
But there's been a lot of studies showing that depending on which level of standardized testing you're doing, it has resulted, if you did well, you've resulted in doing well in medical school. But anecdotally, that's completely the opposite of my experience. I have a lot of friends. I know a lot of physicians who, are in high power positions now in terms of, they're neurosurgeons, and they might have been rejected from residency 3 times, and now they're a fantastic neurosurgeon. So I don't think that just solely focusing on test scores is an adequate way for schools to accept applicants. um, that's just not I don't agree with that. I think you have to look at the whole picture of other things that they're doing. And also, there's a lot of students who just they do poorly their first 2 years of medical school, speaking of US schools. And then when they go into clinical rotations, they really excel,
Yes.
which is what's important. Like being able to communicate with patients, and use whatever you learned and apply it. That's very important. So I have mixed feelings about standardized testing. I understand why they still do it. I think it's great that step one exam has become pass fail, but there's still other exams that you take that are actually graded. It's good that a lot of schools have gone to pass fail for classes, like where you're just, where you're testing, and that your rotations become more important, which again is the skill that you need to be a physician.
Absolutely.
Yeah.
So you're helping all these students around the world, around the in particular in the United States. Um,
Mhm.
the Versus Physicians Coaching.com, right? The Versus means what the
Yes.
Versus means.
So yeah, so Vorsis is actually it was just like a made up word, but vor it stemmed from the word vor, which in Norse mythology means the goddess of knowledge and wisdom. And with coaching, we talk a lot about untapping the other person's wisdom or untapping the wisdom within yourself.
Yeah.
And a coach is there to help you do that. So that's why I chose that for a name.
Thank you, Amruti. That's really talking. Amruti is like a sweet, is one of the eternal drink, immortal drink from even Greek mythology and Indian mythology. Thank you so much. It's a privilege. It is truly an honor and privilege to talk with you. It's a fun talking with you, and you gave all your, without, you opened up, and you're expecting mother now. As I so
Yeah.
soon, wish you all the best. And then you're a doctor for yourself, for the baby and you. Well,
Exactly. Thank you so much. This is a great conversation.
thank you so much. Well, just thank you all. Thank you for attending. It's just I'm going to play that my this short video about the clothes that I designed. You can see that. So we are retelling their stories through our patented designs that can be worn on scrubs, t shirts, printed on conference bags, and endless other promotional materials.